Welcome to the next episode of Pathagonia. Today we're going to talk a little bit about hematopathology, and this is a case from a 6-year-old male. We're looking at his blood smear, and thank you to Path Presenter for this digital slide. This is an example of hereditary spherocytosis. So hereditary spherocytosis is an autosomal dominant inherited disease, and as the name would suggest, it's going to give rise to red blood cells that are shaped like spheres or very circular, and notably they're going to lack this central pallor. So you can see some of these red blood cells have this little white area in the middle of them, and that's that central pallor, but the majority of them are lacking that, and that is what defines this disease, at least morphologically. So spherocytes can be seen in hereditary spherocytosis and also in autoimmune hemolytic anemia. And clinically, these patients are going to present with jaundice. They could have a mild reticulocytosis, gallstones, and splenomegaly. And there's a few mutations or genes to be aware of in hereditary spherocytosis, and that is ANK1 for ankyrin, SLC4A1 for band 3, SPTB for alpha spectrin. So ankyrin, band 3, and alpha spectrin are going to be the most common mutations. And then in the laboratory, you're going to see an increased mean corpuscular hemoglobin concentration, so an elevated MCHC, and you can also have elevated bilirubin and lactate dehydrogenase. Osmotic fragility tests can actually be used for this, although it's less sensitive and specific. You can diagnose this with flow cytometry, and eosin-5 maleimide, or EMA, is going to be decreased in flow cytometry in hereditary spherocytosis patients. And this can be treated with a splenectomy, oftentimes. So quick review, just some take-home points. You're going to have these red blood cells lacking the central pallor, and the most common mutations are ankyrin, band 3, and alpha spectrin. You're going to have an elevated MCHC, you can have jaundice, elevated bilirubin, and reticulocytosis, and that's hereditary spherocytosis.